Hello, my name is Martha Newhouse and I'm a registered nurse, and I am going to be doing a head-to-toe assessment on Bobby Newhouse. He is a 55-year-old male patient and he weighs 210 pounds and is 5 foot 10, so that gives him a BMI of 30.1. Bobby's only major health issue is that he has psoriatic arthritis, and he's had that for about 15 years. He is now presently on Enbrel, which is a subcutaneous once a week injection that he takes, and he follows up with his rheumatologist usually about every 6 months. He's had some major surgeries in the past, or some minor surgeries in the past. He's had outpatient surgery on his knees, his left thumb, and his wrist. He does get colonoscopies done pretty much as prescribed by his physician. The last one he had done was back in October of 2013, and that was negative. He's had blood work done about a year ago, and he was found to have a little bit of an elevation on his cholesterol, but nothing that he had to go on medication for. So he is an avid cyclist. He cycles about four or five times a week, and so far this year, 2014, he has cycled over 1,100 miles on his bicycle, and he does events also. The last one he did was the Dam Jam, and so he is a pretty active man. So right now we're going to go ahead and get his blood pressure and his heart rate, and we'll get the assessment started. Okay, we're now going to go ahead and get Mr. Newhouse's blood pressure, his heart rate, and his temperature. Okay, very good. 120 over 80. Let's get your pulse. Okay, thank you. Your heart rate is 60 beats per minute. You get your temp. Oh, under your tongue. 97.9. All right, very good. Okay, Mr. Newhouse, we're going to go ahead and start the head-to-toe assessment. I'm going to ask you a couple of questions as we're going, and I'll kind of explain what I'm doing. And so, if you have any questions, just let me know. Okay. Um, I'm going to start off with just examining your head, just feeling it, make sure there's no abnormalities noted. Your hair's not like coming off real easily. There doesn't seem to be any dandruff. I see that you have a little psoriasis right here.
Yes.
Okay. What do you put on that when it flares up?
I don't really. I have a little topical solution I put on it when it's real bad.
Okay, all right. It looks pretty good though right now.
Mm-hmm.
It looks like it's pretty clear. You can tell the skin's a little thick there, but other than that, it looks pretty good. Okay. When does it cause you problems? Does it just come and go?
Mostly winter.
Winter time?
Mhm.
Okay, gets really dry.
Mhm.
All right. Okay, very good. All right. I'm gonna examine your ears. Do you have any hearing problems?
No.
No. Okay. Any drainage from your ears?
No.
Nothing at all? Okay. I'm gonna look inside your ears, okay? Up on this one, Steve. Okay, just relax there. Okay. You know what? I'm gonna need to put my glasses on because I'm having a hard time. Sorry about that. Okay. Probably not. Okay, that looks good. Okay, good. Okay. Well, let's go ahead and look up your nose. Any problem with your sinuses? You get frequent sinus infections?
No.
Anything like that?
No.
Okay. Open your mouth. Stick out your tongue for me. Say ah. Okay. Do you go to the dentist regularly?
Yes.
Okay. Any problems with ulcers?
No.
None at all? Okay. Take a look at your eye. Let's just do pupil check here. Let's do a little lights off.
Oh, lost your video.
I did. Guess that wasn't a good idea. Okay. Just looking to see if the pupils are reacting. And they are, so that's normal. Okay. And then okay. Any eye problems?
Nope.
Okay. It looks like you wear contact lenses.
Yes.
How often do you go see your eye doctor?
Once a year.
Once a year? Okay. So you wear contacts all the time?
During the day. Take them out at night.
All right. Do you need them for just reading or?
Mostly reading. Yes.
Reading? Okay. All
And
right.
close.
Okay. All right. You feel any pain up
No.
here?
No.
Okay. How about here?
No.
No? Okay. You feel me
Yes.
here?
Yes.
Okay. Can you frown for me? Okay. Can you blow up your cheeks like you're blowing bubbles? Okay, good. I'm just checking the cranial nerves in your face. And
Okay.
so they all look really good. Okay. What I'm gonna do next is I'm just gonna just feel up here. You have lymph nodes. They're part of our um, immune system. And sometimes when you have a sore throat, you may feel like your throat is a little swollen. So that's what I'm checking for to see if there's any swelling in your neck. Okay. I'm gonna check your carotid. Okay. Good. Okay. Check your throat. Any problems swallowing, heartburn, anything like that?
No.
No? Okay. All right. I'm gonna go ahead and listen to your carotids. And I'm just checking for good blood flow and okay. That's good. Okay, Mr. Newhouse, I'm going to go ahead and have you do your range of motion now. And so I'm going to have you go ahead and tilt your head forward and now back, to the side, to the other side, and then shrug your shoulders for me. Okay, all right, very good. Now I'm going to have you go ahead and push against my hand. This one. Okay, good. And do the same with your shoulders. Okay, these are all testing the cranial nerves. All right, and I'm going to have you go ahead and just sit up and let me, and swallow for me. Okay. No pain?
No.
Okay, no trouble swallowing?
No.
Okay, all right. Now I'm going to go ahead and take your gown off, and I'm going to take a look at your chest. I'm just going to look at it, just to look at your skin, make sure that it's all even, symmetrical. And look at your chest expansion. I'm going to put my hands behind your back, and I'm going to have you take a deep breath in and out, blow it all the way out. Okay, I just put my hands back there to measure that when you take a deep breath in and out, that it's expanding in the same way. I'm going to take a look at your spine. Just run my fingers down your spine. Okay. Any pain, discomfort?
No.
No? Okay. All right, very good. Okay. Now I'm going to go ahead and palpate your lung fields. Okay. Okay. Very good. That sounds good. You know what? I think. Okay, Mr. Newhouse, we're going to go ahead and start with the head to toe assessment. And so I'll be touching you and explaining what I'm going to be doing as I go from head to toe. Okay? First of all, let me take a look at your hands. And I'm just inspecting your hands. Take a look at your nails. It looks like you're a hard-working man. Check your capillary refills. Okay, good. I'm going to check your pulse. Looks like you've had some surgeries on your hand, as
Yes,
we discussed earlier.
Yes.
Just on this one?
No, right there.
Oh, okay, all right. So any problems with your hands?
No.
No?
Just
Okay.
arthritis, but overall they're good.
Okay, all right, very good, thank you. All right. I'm gonna take a look at your scalp. What I'm looking for, it's just any bumps, any bruising, or any type of abnormal areas. It looks like you've got a bit of psoriasis, as we talked about on that. So it looks pretty good though. It doesn't look flaky and all. What do you put on it?
I don't remember the name. It's a topical solution.
Oh, okay. All right. And when does it normally flare up?
In the winter.
The winter time?
Yeah.
Okay. So it looks pretty good right now. Okay. Now I'm just gonna touch your jawbone here. Any pain?
No.
Okay. Can you open your mouth for me? Doing that?
No.
None at all? Okay. I'm gonna get your sinuses. I'm just gonna push down. Any pain there?
No.
No? Okay. Pain?
No pain.
Okay. All right. What we're gonna do now is check your visual. So, okay, let me get my flashlight. Are we still going?
Mm-hmm.
Okay. Okay. Right here. Okay. And I'm going to check your visual field. And so what I'm going to have you do is I'm going to have you cover your eye, and you just do it with this popsicle stick, okay?
You want me to do that?
Uh-huh, yeah. Okay. All right, and I want you to tell me when you see my hand.
I see it all the way through.
Okay. Cover your other eye. Okay. How about now?
Yeah, I see it all.
You do? Okay. All right. So thank you. I'm gonna shine this in your eye, or just I'm gonna check your pupils, see if they react when I. Okay, that was good. Okay, good. I want you to follow now this tongue blade. So just keep your head straight. And just have your eyes follow.
Okay.
Okay, good. All right. All right, I'm going to take a look in. Just take a look here. So if you'll just look straight ahead for me. Okay. Okay, good. Thank you. All right, that looks good. Can you pause it? Okay, I'm going to go to your breath sounds. So, is it
Just keep going, yeah. What's up with that all of a sudden?
I don't know. Okay, Mr. Newhouse, I'm going to go ahead and take a look at your chest. And I'm just looking for, again, that it's symmetrical, see if there's any bumps or lesions or anything like that. I'm going to now just check. Any tenderness?
No, it's delayed again.
Okay. All right. I'm going to percuss. Okay, sounds good. I'm going to have you lean forward. I'm going to listen to your heart. So if you'll lean forward for me. I'm going to listen for any murmurs and just relax. Okay, this is lovely. Tricuspid. Good. Okay, sounds good. All right. Thank you, Mr. Newhouse. Okay, you'll put your hands down by your side. There you go. And I'm just going to take a look at your abdomen. I'm going to check for symmetry again. Check the skin. Check the umbilicus. See if there's any pulsation there. Okay. Now I'm going to listen to breath sounds. Or abdomen sounds. Okay, good. Thank you. All right, now I'm going to go ahead and percuss again. Okay, very good. Percuss over the liver. station and just checking for any lumps. Any pain?
No.
Okay. Now I'm going to go a little bit deeper. Just going to mash down a little bit more. Just try to relax for me. Again, any pain?
No.
No? Sometimes feels like the edge of it. I don't feel it, but we're not supposed to feel your spleen. That means that it's not swollen or anything. Okay. Okay. It looks like just check for any reflexes. Good. All right. Okay. Okay, Miss Newhouse, I'm going to go ahead and I'm going to raise up your gown and we're going to go ahead and check your lower extremities. Okay, just this far. All right. I'm just going to feel your pulses. So raise up your legs some. There you go. Okay. And this one. Okay, good. And your pulses. Good. I don't see any swelling. Your skin and your skin looks good. Your hair distribution's good. Take a look at your toes. Okay. Don't see anything there. Good. Okay. All right. Now I want you to go ahead and, if you can, bring this knee up to your chest. Okay. Lower it.
This one?
Mm-hmm. Okay. Very good. And I want you to go ahead and just point your toes. Good. Okay, very good. All right. Now I want you to take the heel of this foot and ride it up against your leg. Okay, and do the same for the other side. Good. Okay, good. Thank you. All right. So if you can go ahead and stand up. Or sit down. I'm sorry. You just come up. Yeah. Okay. Okay. What I'm going to do is just going to test to see some neurological, if you have any neurological deficits. So you can see this one is a little pointed, kind of sharp, and you tell me when you feel the soft and when you feel the rough, okay? All right. Get it out of here. Okay. And close your eyes.
Pointy. Pointy. Soft. 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 Pointy. Pointy. Pointy.
Okay, good. All right. Okay, you tell me now when you feel a light touch. If you'll go ahead and just close your eyes.
Okay. Now. 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 Now.
Okay, all right. Okay, very good. Thank you. now I want you to go ahead and take your hands, and I want you to go back and forth under that. Back and forth, real quick. Okay, faster, faster.
That's it.
Okay, very good, thank you. All right, now we're gonna go ahead and get your reflexes. This is your bicep reflex. Okay, and now the other. And now I'm going to do your legs. Good. Okay, and then your Achilles. I don't know if you can see that one or not.
Your knees in front of
Oh, let's flip it.
Yeah.
Very good. All right, thank you. Okay, now I'm going to have you go ahead and stand up and come over on this side. Let's tie you up. I'm going to have you just go over to the wheelchair and just walk across the room for me. Okay. Now this time I want you to walk heel to toe, heel to toe. Okay. We're going to walk on your tippy toes.
I don't feel comfortable with this.
All right. This is just, again, checking some of your neurological function. All right. You can go ahead and sit back down. Okay. All right. Any dizziness, any lightheadedness or anything? Okay. All right. Very good. Okay. Now we're going to go ahead and let's see. We got the nail back. Oh, we should have it. Oh yeah. Okay. Okay, Mr. Newton, I'm going to have you check your range of motion with your hands. So if you'll follow me and do this, up in the air. Okay, very good. Okay, back down. All right, very good. Okay, so we're going to go ahead and I'm going to have you lay back. Oh, watch my glasses. All right, sorry about that. Okay, Mr. Newhouse, we're going to go ahead and check your balance, and this is called the Roomberg test. I'm going to have you stand up, and then you're going to close your eyes, and I'm just going to make sure that you're standing still and not falling over, falling back, or anything like that, just keeping your balance. You may sway a little bit, but that's normal, but I'm going to have you stand, right in front of the bed, and I'm also going to be guiding you, okay? So go ahead and stand up. Okay, and then close your eyes and just relax. Okay, so it's normal since you didn't, fall back. All right, so now I'm going to have you stand in front of me, and I'm going to have you go ahead, and if you'll let's just check your range of motion too, and just go forward, bend over.
As far as I can.
Okay, yeah, good. Okay, and back. Okay, and to the side. Okay, very good. All right. You can go ahead and turn around. And you can sit down. And put your gown back on. I didn't step on your toes there. And I'll tie you in the back. Doing okay?
Yes. Okay, Mr. Newhouse, everything, the assessment is done. I really appreciate your patience with me and helping me do the assessment. From what I have assessed, it looks like everything is normal. You're looking really good. I noticed that you do wear contacts, but you didn't tell me that you go see an ophthalmologist regularly, and that your psoriasis seems to be in good control right now, although I know you said it's the winter time where it acts up a little bit. But other than that, you seem to be doing really well. Do you have any questions for me? No.
None at all? Okay. Well, thank you for participating in my head-to-toe assessment. Thank you.
You're welcome.